Hi everyone, Dinesh Sirisena here, and today we're going to be talking about imaging the Flexor Hallucis Longus, or FHL. As with my previous talks, I recommend two resources. First and foremost, the ESSR guidelines for musculoskeletal imaging, and in this case for the ankle. And secondly, ultrasoundcases.info. And here are the images from the ESSR guidelines when scanning the Flexor Hallucis. In their guidelines, they talk about imaging the FHL around the ankle. And remember, the order of the tendons are tibialis posterior, flexor digitorum, and then the neurovascular bundle, and then finally FHL. So FHL is quite posterior and it is quite deep as well. If you are scanning the patient according to the ESSR guidelines, it's useful to have the medial aspect of the ankle exposed, and then you can try and trace it down into the foot as far as possible. In practice, I find that when scanning the FHL in isolation, I would have the patient lying in a prone position. This means that the posterior aspect of the ankle is exposed, the patient is more comfortable, and hopefully the images that you obtain are of better quality as a result. In addition to scanning the FHL tendon around the medial aspect of the ankle, you can also scan it more distally in the foot. To do so, I would use a linear transducer and place it in both a long and short axis orientation over the course of the FHL. Remember that it inserts into the great toe, and so you want to identify a portion of the FHL in this area and then trace it proximally if possible. And this is what you're hoping to see on the ultrasound. So in the short axis orientation, if you're around the level of the sesamoids, you should see the medial and lateral sesamoid and the FHL sitting above it. If you then turn the transducer into a long axis orientation, you should see the linear structure of the Flexor Hallucis Longus. With the prone position of the patient, it should be easier to manipulate the ankle and the foot to first of all identify the FHL, as well as identify if there's any pathologies going on. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter, Instagram, and TikTok. And remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.